Hi, Dr. Mike Carberry here with another episode of AMI Today, and I was looking forward to this version or this edition because I have a very special guest who I get caught up with chatting about, and we might get way off topic, but I want to introduce Dr. Doug Luther from Patient Payment Solutions. And you have another company now as well?
Yes, it's called Patient Options.
Patient Options, and many of you know who he is because you've worked with him, and if you haven't worked with him, you should know who he is because Doug has a very interesting background, and the product of his companies is really key to cash-based services in your office and also even co-payments, right?
Yeah.
So you can help with covering that. So what he does is he offers financing options for your patients, and it makes it so that a patient can afford the care that you recommend. So Doug, welcome.
Thanks, Mike. Thanks for having me.
Yeah.
So,
it's good to see you. You just came down from Alaska.
just came down from Alaska. We flew down late last night, so I'm getting over a little bit of jet lag, but I'm used to this, so it's not too new for me.
Right. Now you're originally from Alaska, or you're from Northwest?
No, I'm actually originally from Florida.
I did. Oh, you did tell me that one time.
I did tell you that, yeah.
What part of Florida?
Clearwater, Tampa, St. Pete.
Clearwater, Tampa, St. Pete. Okay. So now you live in Alaska.
Live in Alaska.
I've been up to visit Doug, and we went on an awesome fishing trip, my son-in-law and I and you, way up a river. I don't even know what river it was, but it was an awesome trip. We caught a lot of fish and saw a lot of wildlife. And now here we are sitting in Chattanooga talking about AMI Today and your companies. For our listeners who don't know who you are, why don't you give us a little background? You're a chiropractor. Tell us how you became a chiropractor and how you got into financing.
Well, my whole family's been involved in healthcare for a long time, and I got turned on to being a chiropractor from a friend of mine in undergrad, and I worked at a chiropractic office to see what it was like, and I really enjoyed the experience. And ultimately, 20 years, 30 years later, well, 25 years later, here I am. I've been in practice now for 20 years myself, and I still practice.
Wow, that's good. So along the way, encountered some things. You grew your practice. You started off in where? Your first practice? Is it the one you have now?
Seattle. Seattle area, yeah.
And you had a practice there, and then you moved to Alaska. That's an interesting choice. Is it because you're an outdoors guy, or was there another reason to move to Alaska? Or?
I'm a high-tech redneck, Mike.
Oh, there you go.
Yeah.
Okay.
So
I
love the outdoors.
You're Scottish, and you're related to maybe
the Duck Dynasty
Duck
clan.
Dynasty.
I don't know. I have some Robertson roots, and my grandmother's maiden name is Robertson. So
okay.
I like to say that though. That sounds kind of catchy.
So now we know why you're in Alaska, and that's good. But you also have a practice in Alaska, and a lot of people are probably wondering, what's it like to practice in Alaska? Is it much different than anywhere else?
It's the same as anywhere else. We have the same rules and regulations, and we are a state. We do not live in igloos. So
right. when I was up to see you in Alaska, I got to admit, I called Colleen and I said, it looks just like Alpharetta, Georgia. Parts of Anchorage does, not the mountains, but like the shopping centers and everything else.
Yeah.
So. But anyway, so as you were practicing, at some point you decided that you needed to become a compliance officer. Tell us about that.
Yes. Well, I think compliance is like a dirty word to chiropractors, and it's you want to run the other way when you hear that term. And whenever I try to get a question answered from somebody who's a designated compliance officer, they say no. That's the answer. Can I do this? No. Can I do this? No. And so I started asking the question, what can I do? Or tell me how I can do this. And that kind of dumbfounded a lot of people. Mm-hmm. So these so-called compliance experts. So I went on and I got the full certification myself. And that makes me look at the world a lot differently nowadays. I think it's a good thing.
How involved was that training in that certification process?
There's different training like modules and types. And it's I think it's a 40-hour course what I did. And it was really enlightening. It tells you, it gives you guidelines. Compliance is like a speedometer or speed limit. 55 miles an hour is the speed limit, and sometimes you can go a little bit over, but if you push the boundaries, you can get into trouble.
Is it the speed limit in Alaska? Because the speed limit down here is 70.
It's 70 there too.
Okay.
When I was a kid, it was 55.
Well, in Oregon, it was 55.
Really?
I lived in Oregon for 5 years. I'm like, this is the slowest pace I've ever lived.
I know. Yeah.
But after a while, you get kind of caught in a groove, and you're not really racing down the road because nobody else is either. So
yeah. Yeah.
I did get a couple tickets when I first went out there. So
you got to practice with bit by bit, yeah.
So now you're the compliance officer, and you understand, you did this basically for your own practice, right?
Yes.
But
yes.
you realize you could apply that to other doctors. You know, I'm a chiropractor, and although I've learned compliance over the years, I learned more medical necessity than I did compliance. And I learned that because I ran medical clinics, and I wanted to make sure what we were doing, we would get paid for it and not have to pay it back. So I had to study medical necessity. Now I'm actually, I teach it in a lot of states for continuing ed. But you have a similar, I mean, that's the reason you went into compliance, is to make it better for your practice, right?
Yes. Yeah. I have a lot of people whom I went to school with who are always asking me questions. They're calling me on the phone. And I was trying to help them out to the best I could, but I wanted to be more definitive in my answers.
Okay.
So hence, and then it evolved into this right now.
So you became a compliance officer, and at what point did you realize there was an opportunity in financing to help patients get services that are not covered? Because chiropractors, a lot of what we do in a lot of states is not covered. Some of what we do is covered, but not everything we do. Yeah. And so there's usually a pretty big cash component to a chiropractic office. Now, we do medical offices, but we're not the typical medical office. We're doing, I guess you could call it alternative medicine treatments. Yeah. And they're not risky, but they're not covered either. So you have to know how to get people to be able to afford them, and people like to use their insurance. The thing that I like about your company is, I've said this to patients. Patients go, I can't afford to do that. Well, you really need it. I know, but I can't afford it. Well, listen, if your insurance would cover this at 100%, how much could you afford per month for your insurance to be increased to that level? And I would have people say, like, I don't know, $75 a month or $100 a month. And I'm like, well, let's see if we can finance that. And then all of a sudden, boom, there you go. And they go, I never thought of it that way. And then all of a sudden, they were affording it. So how did you get into the finance business, like financing people?
When I started 20 years ago, we had this thing called a copay. It was flat $10, $15. And then a couple years into practice, I got hit with this thing called a deductible. I had no idea how to handle that during a financial consult.
Right.
And now these deductibles are routine, and there's no such thing as a copay anymore. There's a thing called a coinsurance, which is typically a percentage of the allowable amount. So there's all these complex ideas and issues going on out there, and a lot of docs don't really know how to handle that. So I said, I got to find a solution to this, and it's the curse of the entrepreneur, finding solutions to problems and then bringing it to the world, and that's ultimately what I started, and it's evolved into a much bigger, financial solution right now, because it's all changing.
When we first met you and I first started working with you, you had patient payment solutions.
Yeah.
And that was a method where you could actually, I don't want to say be a collection agency, but that's kind of how you were functioning. You were helping to collect that bill as a third party for the doctor to be able to collect his co-payments. I know as a doctor I can't afford to say to a patient, well, I'll put you on payments, because then I'd be paying a lot of people money to follow the accounts of our different clients, and that would be very expensive. But having a company like you do it, it does a couple things. One, the patient perception is, oh, this outside company, they're going to come after me if I don't pay my bill. I remember hearing a statistic years ago that they surveyed people and said, who are the most important people to pay your bills to, and who are the least important? And the least important was always lawyers and doctors. And the reasoning was, oh, well, they're rich anyway. They don't need it. They won't even miss it. Yeah. And some of the doctors, that's true. They don't even notice that they don't get paid. But I couldn't afford to do that because, I mean, I wasn't rich, and I had to get paid, to cover my overhead. So having an outside company cover that and follow that up increased the chance of getting paid, because they were not sure that you were a doctor. They were thinking it's a collection agency, it's a bank, and they're going to come after me if I don't pay it. So it was very helpful. But it also gave us the ability to put our patients on payments and not have to track it. You were very helpful that way. Did I get that right?
Yes.
Okay. And you've worked with our clients pretty successfully. I know a lot of our clients have worked with you over the years, and you've helped scratch that itch that they had as far as financing. But tell me about your new company. What are you doing with that?
Well, one of the issues we face, and is that a lot of chiropractors have insurance-based services and cash-based services all under one roof, and then, for that matter, personal injury and workers' comp. And a lot of doctors give discounts for self-pay or cash-based patients. And one of the problems is there's various state and federal laws in existence that that prohibit that. And there's also provider contracting issues that prohibit that. And there's a thing called a dual fee schedule, which you've heard the term.
Yep.
And so what we do is we contract with providers directly, and at no fee to patients to participate, we allow providers to give discounts to patients on a contractual basis. So it's not a self-pay discount, not a cash discount, it's a contractual discount with us, basically on file. So it's a way to circumvent certain rules and laws that is solves another problem for a lot of providers out there.
So they have to follow, most people don't know this, they think the doctors just can change their fee schedule, but if they're charging an insurance company something, then they have to charge the patient their portion of that, or at least attempt to collect it.
Correct.
Right? So why don't we talk about that for a minute?
Okay, and that's more of a patient payment solutions thing.
Right, but
and so
where I'm going with this is a lot of doctors don't know the law of what they have to do to be compliant in their attempts to collect from a patient.
Yes.
And the thing I liked about your company is you made sure we were compliant.
Yeah. First of all, know the law.
Yeah.
I have several attorneys I work with on speed dial, and you know the law. And once you know the law, then you can find a way to work with that, following that to follow your rules. But there are ways to do certain due diligence requirements, and every state's a wee bit different as far as your requirement to collect a patient portion, be it deductible and or coinsurance, that you have to follow. And a lot of federal rules are on top of that. Most states follow Medicare's guidelines. And what I would encourage for people that have questions, get a competent attorney licensed in their state to specifically address their questions. But we work with a lot of clinics solving that exact issue based on what their needs are.
Right.
And following up with that.
A lot of times doctors find themselves in this catch-22 where they have their heart in what they're doing. They understand there's got to be a fee for what they do, and there's a portion that the patient has to pay, and the patient might be in a position where they can't afford to pay that, and the doctor wants to work with them, but they can't just waive that.
Yeah.
They have to actually understand the law and say, look, I have to make certain attempts to collect this bill from this patient, and they don't have to collect it, but they have to attempt to collect it.
Yeah.
And what you've helped us with is in fulfilling that so that we're compliant, because if we don't attempt to collect that, we're in trouble. And what's interesting about that is, it's really, over the years, I've really had a boost in my faith in humanity, because most patients want to pay their bill. And most patients will pay their bill off. Even though you don't have to get them to pay the whole thing, you have to attempt to get them to collect it.
Yeah.
But what we find is most patients are just like, no, I want to take care of this. You really helped me. I want to pay the bill. I want to make sure you get paid everything you deserve, which is really nice. But to be compliant and follow that, you've been very helpful in that, in the collection part of your business. But now in the new part of your business, doctors, instead of waiting for that money, you have a way that they can get paid up front. Why don't you explain that?
Everybody asks the same question when we talk to a prospective client. It's like, I want to get paid up front. Stem cell, for example, I know a lot of doctors are doing stem cell or regenerative medicine.
Right.
Let me rephrase that. Therapies where there's a larger case value up front.
Right. And a larger investment by the doctor in getting the cells in the office.
And so it behooves them from a financial perspective to cover their bases up front. So we have two options for that. The first option is where we pay the patient directly, 100% of the money. We shop for multiple lenders at the same time. That's attractive, but a lot of doctors say, hey, I want to get paid. And so we just recently, literally a couple weeks ago, launched a new thing where the doctors themselves, their clinics, get paid up front within 24 to 48 hours for all the services that they're approved for, or I should say the patient's approved for. So there's a lot of bigger lenders out there. We've all heard of them, and they're attractive in the sense of getting paid up front. But our solution hopefully addresses like literally all of our bases being covered.
Okay.
So that's the game plan. I saw the future on the wall, and I want to address that. So I did that.
Yeah, and that is attractive to our guys because of the investment. To get the cells in, it's expensive, and what our clients fear is, I invest this money, I inject the patient, they walk out the door with all that money, and I'm waiting for my payment, and you can get into yourself in a bind with, especially with the wrong type of patient base.
Yeah.
And so getting paid up front is a barrier that a lot of patients had. And I remember saying when we first started doing regenerative medicine, and it's expensive, and we tell patients you have to pay it up front. We can't put you on a payment plan. And so we'd have patients actually budget themselves and say, all right, look, I'll get them injected on this date, and that gives me 3 payments I can make between now and then to pay for those cells to get that injected on that date. But now with this, you can get them paid up front, and then they're actually paying back to your company or to the investor?
Well, we pay we have a bunch of banks working underneath us. It's a big spider web of relationships.
Okay.
But we pay one of our lenders will pay the doctor directly in 1 to 2 business days.
Okay.
So.
And then the patient is the one who's paying the payments.
Correct.
And so there's an interest rate, which is fair because there is a loan. And it makes it possible for the patient to get the services, and they could pay it out over time. I've had a lot of doctors tell me, patients won't pay that amount of money. And I go, well, if the amount of services that are not covered, let's say it's $5,000 or $7,000, one of the things I point out to them is I go, listen, if you don't get them under your care and they go to the medical care, is that bill going to be bigger or smaller? Well, they have insurance. Oh, right, they have insurance, but it's going to be bigger. And the number one reason for personal bankruptcy in the United States, as you know, is unpaid medical bills. And 72% of those people had insurance. So you look at it, you go, the insurance isn't really helping them out of this bind. I mean, if they have to pay 15% or 30% or in some cases 40% of a bill, and the bill for surgery can be like $200,000, you're talking some big money. And you can see why people go broke, and it's the number one reason for personal bankruptcy in the United States. So by getting this financing, you go, well, geez, they had to pay $40,000 towards their medical bills? That's horrible. Well, how much did they pay for their car? Oh, I drive a Mercedes. Well, how much was that? $60,000. Yeah. Did you pay for that? Well, not all up front. I financed it. Oh, well, guess what? So it's the same thing. And what's more important, your car or your health? And that's how we approach it.
Yeah.
Because, I mean, we don't have too many people with that type of bill, but, when somebody's asking, say they're doing regenerative medicine on multiple body parts, and it might be, $10,000 of uncovered services, what's more important, your health or your car? Do you drive a $10,000 car? No, I have a much better car than that. Well, okay. What's more important? And it's an easier way to do it because you can finance them. And you've really opened up that door for a lot of our doctors because patients recognize that, let's say the bill for our whole care plan is $15,000 and half of it or 60% of it is paid by insurance. If they would get surgery, that wouldn't even pay for the anesthesiologist to put them under to get the surgery, plus the side effects, plus the risk and everything else. So what you're doing is actually a really good thing for our clients, for their patients, and for humanity, actually. So how big is your company? I mean, what states do you work in? Or is there any that you don't work in?
I think we work in all now.
Do you have clients in Hawaii as well?
I think so.
Wow.
I don't know. We have so many now. We're very fortunate. We started small and we had our growing pains, but it has grown a lot now that I really don't. I mean, I call myself the puppet master, how I operate all my staff, because I have staff in multiple states too, and how I delegate and work with everybody has their certain job functions and duties, and I focus on the bigger managerial issues.
Do you know how many employees you have?
Yeah, I have 14.
Okay, that is bigger.
Yeah.
Because I remember when you first started, it was a family operation. I know your wife was involved, and I think some of your kids, maybe not.
Well, no, not yet, but we'll see.
Okay. Well,
we're moving in that direction.
I know your wife was involved. So.
She's still involved. She's the CEO, Mike.
Good.
Let's be honest.
Okay. So you're growing. What do you see as far as the future goes? I mean,
we're growing very fast. I mean, very fast. With this new rollout of this new system, I think the sky's the limit. I'm going to start focusing a lot on dentistry stuff. We have issues with fertility clinics. I don't know what's going on with healthcare, but I do know cash is king, and I do know we have to get paid as doctors, and whatever we do, we have to find some way to make it build a bridge between a patient relationship and us, and I think this solves a lot of those issues.
Right. So you're looking at, if you look at dentistry, they have usually 50% coverage, so they need service like this.
Yeah.
Plastic surgeons usually have 0% coverage.
Yeah.
They need services like this. Do you do anything with veterinary?
Not yet. We have I think we have a few clinics, veterinary clinics, but because I'm a chiropractor, I speak the language. There's certain like common denominational language we use talking with patients and each other, and so I'm very familiar with that. So dentistry is a newer venue for us. We have some dentists, but I'm just
that's good. I'm sure it's going to
dipping my toes in that water right now.
I'm sure it's going to get very big for you because they do need financing. And there used to be a program called DenCharge, which became Care Credit, and because it started off with dentists, and then that evolved into the chiropractic world. One of the frustrations we had with that company is the only people who got approved were the people who didn't need a loan.
Yeah.
And that was very frustrating because the people who actually really needed the loan, they were usually not getting approved. One of the things you did over the years to help us with that is you even had a program for a while, and I don't know if you still do this, where you had investors and you would bid out something. Am I getting that wrong? Or
No, that's kind of like what we do right now. You've heard of Rocket Mortgage.
Yeah.
There's multiple lenders competing for a certain like goal. And we all have our like specialties that we work on in either chiropractic or let's say maybe cosmetic surgery or dentistry or whatnot. But what we do is everybody's credit profile is a wee bit different, a prospective patient. And so every bank has a little bit different profile they cater to. And so all these banks are competing there's 25 of them, for this patient's business. And so based on the credit profile, with our algorithm and our computer, application, all the banks will submit, or I guess, give competing offers. And whichever offer works best for that patient is the one they'll probably choose.
So the patient actually gets options.
Patient gets options, yeah. And
Wow.
so that's attractive, like terms, conditions, APR, length of the loan, and it's attractive in that sense because, from a patient perspective, they can make a deal.
How far out is the longest loan that you're currently doing now?
72 months.
72 months. That's actually longer than most people get for their car.
Yeah.
So it's got to be very affordable for people.
Yeah, you can create whatever terms and conditions you want. You can apply based on the length of the loan you want to pay, based on the credit, you don't want to exceed XYZ, like APR. So you can put in various parameters.
Right.
Based on what works best for you.
So if one of our doctors who's new to us and joins us and wants to know how to do this, I mean, because that is a game changer when you're talking about cash sales in a medical office. Having the financing to do it, it's as simple as saying to somebody, look, how much could you pay extra on your insurance to get this covered at 100%, and then maybe work the loan towards that payment.
Yeah.
And it makes it very easy for a patient. It means that the chiropractor, or the doctor, the medical doctor, chiropractor, the nurse practitioner, whoever it is going to have a lot more services delivered because they're able to finance the services. What do they have to go through? What's the first step for a new client to reach out to you, and how do they become a client of yours?
Well, the first step is they go to our website and apply. And the application process, there's an application fee involved. We do ask some personal information from you, and that's to basically vet you. There's a few bad apples that require us,
I can imagine,
to kind of vet everybody and
Yep.
cover our bases. And then what we do is depending on what product you want, what type of financing you want, we may ask for certain copies of your driver's license, copies of your current professional medical chiropractic license, utility bills, a check with knowing where we want to deposit the money.
right?
And every now and then underwriting requires some other like unforeseen question answered.
Is there any fees paid by the doctor for the patient's loan?
Depending on what type of loan. Now, the doctor pays zero, nothing, if we pay the patient directly. And that's attractive because the doctor, in that point, gets 100% of the money. Some doctors don't like that. We haven't really seen it happen. They're afraid of patients getting the money and running away on a vacation to,
Right.
Cabo San Lucas. And there are ways to combat that, and I could talk to you, but I won't under this circumstance. The other option is if the doctor chooses to get paid directly,
Right.
the fee to the doctor is between 3.9% and 13.9% reduction in the money. So on $100, if the case that the doctor would have a $3 or 3.9% to a 13.9% reduction in the money that we pay them. And that is shared by the patient as well as the doctor, meaning the greater the reduction the doctor pays, the patient obviously represents a higher credit risk.
Right.
And so what happens is the patient would pay a little bit higher interest rate on that loan. So
and those patients most likely would know they are at credit risk when they come in.
they do.
Yeah.
They do. And but every bank has their own algorithm that they determine their happy place, risk and reward. And so, everybody's a little bit different in what their qualifications allow.
Right. So is there any screening of what services you're offering that gets covered?
Yes, there are. And it depends, once again, on which product you want. If you want the direct pay to the doctor's office where we pay the direct, there is a little bit higher screening that we have to go through. If you want the patient to be paid directly, there's not as much screening. And then if you want to set up certain payment plans, there is an element of screening. So it's all a little bit different, and quite frankly, those criteria change year by year as the banks see fit. So depending on when they apply, that's when we'll tell them what is or isn't allowed.
Okay. So then the best thing to do is go to your website. What is your website again?
Patientpaymentsolutions.com.
Okay.
And you can learn
both
about
companies
us.
are an option there?
No. The other company is called patientoptions.org, O-R-G. And that's where we can set up certain fee schedules for self-pay patients, whatnot. So that's a different entity, but they two kind of mesh together quite well.
Yeah, and it's important for our clients to have this option because I know in my clinics I'm collecting probably 40% cash of my total collections because there's a lot of things that are not covered. Unfortunately, in the insurance industry, there's this steering towards pharmaceuticals. And everybody has their conspiracy theories, and I have mine, and mine are based pretty much on knowledge because I have family members that are in the pharmaceutical industry. But if it doesn't go to a drug, it's usually not covered. So that means a lot of services out there that are very valid services and work very well, like regenerative medicine, are usually not covered. And this gives the availability of that patient to actually pursue them as if they were covered, and they just have to pay a little bit more each month until it's paid off, and then they don't have to pay that anymore. So it makes it very, very easy for them. Anything you want to add before we break and let our clients know about your services and what they can do with you and some of the advantages?
Not offhand. I will say that when I got started as a chiropractor, I didn't foresee myself starting companies. I just wanted to be out, go fishing, and hang out and do the fun stuff that we wanted. But what I realized is that you get into reality in school, and then all of a sudden you realize there's all this business stuff, and we get so dang focused on running our business and juggling these balls simultaneously that we can't do that stuff. So I tell clients, I say, do what you do best and outsource the rest. And I think that's good advice because we all have our own certain skill sets, and our skill sets are with patients or managing a company. It's not with collecting bills or the minutia of how do we apply this deductible and when. So.
Right. Yeah, I was just thinking as you were saying that, when I first started practice 30 years ago, everybody had a $100 deductible and a $10 copay. Yeah. And now we're talking like, a lot of people have their deductible in the thousands, anywhere from $2,000 to $5,000, and sometimes even greater than that. Yeah. And so this service is something, but what I realized is when I was practicing and the Affordable Care Act passed, it did do one thing positive for the country. It made Americans realize these insurance companies are not staying up at night worrying, is Mike going to be healthy tomorrow? They're worrying about, is Mike going to pay his bill tomorrow? And they're not going to want to pay everything back, and they're glad that I have this amount that I have to pay on my own. So America got conditioned very quickly that they have to start ponying up for their health care. Yeah. And so looking for these options like your company has been something that has been accepted even by the patients, and I mean, frankly, it does work. So I appreciate what you're doing for us and for our group and for our country, because it makes it so people can afford care that's a little bit smarter, less invasive, less dangerous, and a lot of times more effective.
Well, thank you much.
Yeah, well, thanks for being here. This is Dr. Mike Carberry. Thanks for tuning in, and thank you to Doug Luther, and we'll see you on the next episode of AMI Today.